Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Well, not really. So a vaccine will help us get to normal alongside testing and alongside better treatments, but it's all part of your strategy. So I was fascinated to talk to people in Australia who say a vaccine will help them with elimination. And this is how it might be used in East Asia to actually just get rid of the virus by ring vaccination, where you vaccinate anyone who's been exposed to the virus. In the UK, they're talking about the vaccine, just vaccinating the vulnerable and the elderly and letting the young acquiring the virus normally. So I think a vaccine will help for a strategy, but it's not the silver bullet or the fairy tale ending of this pandemic. It's just an additional tool. And I think we need to be realistic with people of what a vaccine can and cannot do.
So is there a strategy that you would suggest for a country like India?
Well, I think it comes back to what would be the most effective way. So what struck me looking at India is about half the deaths have been in people under the age of 60, which means even if you vaccinated everyone over the age of 65, you wouldn't prevent many of the deaths if you let the virus go through the young, meaning the people under 60. So actually, probably in India, you'd first want to use it as a strategy of suppression. So you go after those who seem to be most likely to be exposed to the virus, essential workers, those who are out every day. And then from that, try to work out to actually trying to suppress the virus at a larger scale. I think just adopting a flu strategy is very hard with this virus because it's not like it only kills people over the age of 70 or 75. It actually can kill young people too, especially if they have other health issues. And so I think for a country like India, probably for suppression is the right way to go.
I see the debate and I see your interventions in it. And that comes up when people say herd immunity, let the young go out and get infected and protect. So basically, people of your age should go out and get infected, and people of my age should be hidden, wrapped in cotton wool, and protected. And I know that you have sharp views on it. Will you elaborate?
It's not just me. I mean, if you look, the WHO Director General has called this, immoral, unscientific. Dr. Fauci in the United States, a longtime, infectious disease physician, has called it immoral and pseudoscience. Numerous infectious disease societies have come out saying this is not a strategy. We have never used herd immunity as a strategy to any infectious disease in the past. We've never said to whether it's cholera or plague or malaria or TB, oh, we'll just let people get it and at some point it'll stop. Like, this is bordering on just, something that can be run in a computer simulation or sounds great in theory, but we've never actually implemented it. And to take such a risk with people's lives and the economies, because what people don't seem to realize is they seem to think either we take COVID deaths or we have our normal life. And for all those deaths, we can continue with normal life. But that's not how it plays out. What you're seeing is uncontrolled transmission is actually the worst thing for your economy because people get scared. Their behavior changes. Your health services, we're seeing this now in Europe. I mean, the beds start filling up in hospitals. And so all of a sudden, you're forced into lockdowns and restrictions because this virus leads to such high rates of hospitalization. And so in a way, my take on that is this herd immunity strategy is going to lead to a lot of deaths, economic pain, as well as health services being overrun, so more lockdowns. And so though they might couch it as this is the way to avoid lockdowns, if we see how it's played out for the past 9 months, that is the path to lockdowns, because we know uncontrolled transmission of this virus will decimate health services and force governments to have to stop social contact in a very draconian way. Yes, I think this is what is astonishing is that at the start, there was the idea you could delay the economic impact by, not having restrictions, where the FT has done great analysis showing that, Norway, Finland, and Sweden all took about the same economic hit. Sweden's deaths per capita are much, much higher. So the economic pain comes. It's if you take the deaths as well. And actually the places winning with their economies and their health are East Asian countries, South Korea, Hong Kong, Taiwan, Australia, and the Pacific, New Zealand, who are kind of following the East Asian model. They're even like Taiwan is seeing an increase in its GDP, astonishing. And you're thinking how? And it's because they dealt with their public health problem, then they dealt with their economic problem, and then they figured out how to get international travel going and forming these travel bubbles, which are quite fascinating in terms of you get COVID free. And so you have similar prevalence, and you can allow travel without actually friction between those places. But not just Sweden. I think many European countries is that they're kind of caught between their economies and their health. And exactly that, they're kind of losing it both instead of choosing their strategy. I think also it's interesting that many of the modelers and the infectious disease community says this virus is uncontrollable. It's uncontrollable. So it's interesting that East Asian scientists think it is controllable. And so you also the countries who think it's controllable have controlled it. The countries who said we could never control this, even as back as January and February, there was articles written by scientists saying everyone is going to get this. And those countries, everyone, not everyone's getting it, but it's been harder to check it. So in a way, it's become a self-fulfilling prophecy. If you thought it could be controlled, your government controlled it. If you thought you could manage it like SARS, you manage it like SARS. If you thought this was like flu, it's been managed like flu. In a way, those kind of choices and mindset dictated how it's actually played out.
So what does this scientist believe?
Well, I'm very influenced because I've been following this from January by the East Asian model. I'm just in awe of these governments because of the logistics, the data science, the commitment to their populations, how advanced they've been in their planning. I mean, even Japan, they never did a lockdown. They've taken a hit, but they've given good advice around face masks, around avoiding crowded places. I personally lean to the East Asian model because I say there is a path through this which avoids a lot of death, economic damage, and keeps your society running. So why wouldn't you take that path? I don't understand it. And I don't know whether it's in the West, whether it's lack of humility. And we're so used for example, in Britain or America to telling the world what to do because we are seen as the leaders, especially in pandemic preparedness. The UK and US were always ranked the highest. So we're used to going into countries and saying, Senegal, you need to do this, and South Africa, this, or India, that.
How frequent is that? How prolific is that? And how troublesome is that?
So on the prevalence, this is a big matter of debate because in the UK, they didn't test anyone in March at all for this virus, only if you were admitted to hospital. So many people suffered at home and they suffered for months, but they never know if they had COVID or not. And you can give an antibody test, but the antibody tests aren't very reliable and antibodies fade. So a colleague of mine, for example, she knows she had COVID. She was in hospital. She took an antibody test. 12 weeks later, it was positive. She took one 15 weeks later, it was negative. So if she had just had that antibody test at the end at 15 weeks, she would have think she never had COVID. It's only because she had the previous markers. So the prevalence is a really tricky one. I think, some studies are starting to come out and they estimate it. I think some of the lower estimates are around 2%. Some of the higher estimates are a third. So that's kind of the range. At a population level, even 1% would be a lot, especially in that age range, 30 to 60, which it seems to hit. How worrisome is it? I think it's incredibly worrying because these are young and healthy people. And even if we take away quality of life from an economic perspective, that means that those people won't be able to work. They'll be on sick leave. They won't be able to earn. They're also needing rehabilitation from health services. So here we have a public funded health service. So the NHS is trying to set up rehabilitation centers, physio. That's a huge cost. You're having young people who would have long lives being healthy, not in your health service, suddenly needing care and support. So I think, looking at Sweden, we talked about its change. I think one of the things that must have hit them is about 180,000 Swedish people came forward with long COVID. That's going to, in some way, the people who survive are harder for your system than the people who die, because the people who die don't keep straining resources. So it sounds terrible, but from a purely economic perspective, you don't want young people getting sick, especially if they live a long time, but they live unhealthily because it's a drain on your system. So I think actually, though, it's some way a false balance, because what we're seeing is that if you have too many COVID patients, your health services can't run for anything else. We're already seeing this now in Europe where they're stopping non-essential surgeries, they're delaying appointments because your doctors are too occupied taking care of COVID patients who are dying in front of you or need oxygen in front of you rather than worrying about the person who needs chemotherapy in 3 months. So the best way to save your health services is to keep your numbers low. Then the question becomes, how do you keep your numbers low? And actually, lockdowns are a very crude way to do it. You're locking everybody down. The social and economic costs are massive. So that's where you're testing. And I think I've been a huge advocate of testing because I think it's one of the few tools we have to say, is someone infectious? And if they are infectious, let's get them out of the pool so they're not infecting others and try to break those chains of transmission. So I think, repeated lockdowns is not the way. And one of my last Guardian articles was called that. Continuous lockdowns are not the way because the costs are so high. But there are other ways, and countries are finding them through building up massive diagnostics. This is one of the ways Germany in Europe has been able to keep its numbers low. It just runs mass testing. So if you come into hospital, you're tested. If you arrive in the country, you're tested. If you want to go to the nearest train station, you get tested and it's free. And yes, the costs are high of testing, but the costs of locking down are much higher.
Indian model. You mentioned India earlier on in this conversation. What is a good takeaway from what India has done, and what is a bad takeaway from what India has done?
Well, I think what has been good is actually trying to be proactive. I think India tried to respond much earlier than European countries and understood the severity. I think the testing and the tracing, they made a big effort to try to get that up and running. to try to do it locally. And I think you see, of course, differences in states. I think what probably was quite a difficult decision was the lockdowns and the economic harm done through lockdowns. And especially, I think, at least here, we saw the images of, migrant workers walking for hours, days, because there was no work for them anymore. So I think, the lesson, I think, from India is that lockdowns are really a last resort. And if people have the choice, and it's the same choice in the UK, to be fair, that we're seeing as financial support withdraws. If your choice is between feeding your family or between getting COVID, you're probably going to choose getting COVID. Because, do you see what I mean? It's you can't force people to choose between their economic life and their health, because they'll choose economic life because they want to support their families. Right. So I think that's the big lesson, which is how do we make sure people never have to make those decisions between their families and between eating and between getting an infectious disease.
So vaccine nationalism, how will that affect a country like India?
Yeah, this is really worrying, this vaccine nationalism, because what you don't want to have is someone develops a vaccine and then hoards all the doses and doesn't manufacture it for anyone else. And we're already seeing the UK trying to make deals to acquire doses of a whole portfolio. The US, they're pushing for this. And so the WHO is trying, the World Health Organization is trying to reach these prearranged deals, because it's easier to make a deal before we have a vaccine everyone can agree to than after.
Right.
But it is worrisome, because we've seen in the past that there's always a scramble for new research products, and it usually goes to the countries that can pay the most.
Yeah. And efficacy of vaccines, WHO says 50% is okay. Which vaccine is a vaccine?
This is a really tricky one, because there's such pressure to have a vaccine. The question is, what does a vaccine actually do? And WHO has put that bar there. I don't think we'll have a perfect vaccine. I think we'll have multiple vaccines. There are 11 in phase 3. So I think at each stage, it's going to be assessing each one. And it may not be the one that's fastest. It might be the one that takes a bit longer, that's more effective, that ends up winning out. But I think right now, there are 11 different candidates. So I'm really hopeful that one of the 11, given that they have passed phase 1 and phase 2 trials, will come through in phase 3. And then it'll be an issue of who do you actually vaccinate first, towards what strategy, how do you manufacture enough doses, how do you make sure all parts of the world get it, you don't just prioritize certain populations. So those are going to be the pricing, who pays for them. Those are all going to be the next stage of questions.
Have you found more of these go wrong? Because they've been models and models and models beginning February. Or some have come closer to accuracy?
It's the old joke, right? You can find every model to back up whatever you want to say, right? You just build your model around what you want. And I think that's very true. So Donald Trump, the president, took a model. He saw 6 different models. The one that said you'd have the least death, he said, that's my favorite model. And he took that one, right? I think models, they're not perfect. So in the UK, for example, they modeled health service capacity. What they missed to put in was doctors and nurses. They looked at number of beds. How many beds we have in the hospital. They didn't anticipate that many healthcare workers would not be able to work because they were sick with COVID. So your model falls apart at that point, because you modeled something that isn't realistic to real life. They also modeled care homes, but they forgot to model that people who work in care homes work in many different care homes. They go between them. So it's not like each care home is a bubble. You have people who will go between them, because a lot of them are on very, poorly paid contracts. So they work 4 or 5 different contracts to try to make enough income. So I think with models, I see them, I am interested to read them. I look at the assumptions, but they're just one input. I also would go in, I think one of the mistakes, for example, with health service capacity is if you talk to any doctor in an ICU or someone who runs a hospital, their biggest worry was having enough staff, not having enough beds. The beds wasn't the issue, was the staff. So you have to kind of cross-check it with, other sources of data. Yeah, so, I think this is my main frustration with, I would say, higher income countries has been the lack of humility. They're so used to knowing best. At a certain point, you have to say, what can we learn from other countries? What can South Korea teach us? What can Taiwan teach us? What can we learn from India or Kerala? What can we learn from Thailand? We need to look abroad and realize other countries might know more about infectious disease management than we do. But we're just, as a country, not used to thinking that way. We're used to everything. Especially under Boris Johnson, everything has to be world beating and leading and the best. And we are the best leader. These are the language you're using, which isn't really one around humility. It's one around trying to beat every other country through showing exceptionalism. And I think exceptionalism works in some ways. You might say, oh, everyone's doing it that way, we're going to go this way because we know better. But in a pandemic, that's not the time to do it. If that way is working, you go that way too. You don't try to kind of go in a different direction just to be different.
You talked about virus being in the air. Now, how serious a threat is that? And how far does it go in the air?
So this is something I think that hasn't been emphasized enough. We focused a lot on hand washing around 1 or 2 meter distancing, but I think we've seen enough from whether it's gym, fitness studios, whether it's cruise ships, whether it is restaurants, to know that in air conditioning, the air where people are breathing heavily and there a long time, the virus can circulate a longer distance than 1 or 2 meters. Meaning if I'm in a bar, very crowded, but I am, let's say, 6 meters away from someone, if they are infectious and it's crowded and closed, it's likely I will get infected too, as well as all the other people there. If I am outside in a park, same distance, I probably won't be infected. So I think it's ventilation and it's, how crowded people are and how much new air do you have coming in. So this is something I think we haven't emphasized enough. I think, now if you go to places, people think, oh, if I'm 2 meters away, I'm safe. Or I'm saying, yes, if the windows are open or there's filtration systems, but if there's no air and it's just closed off, the virus will travel. We know that because we've seen those places, people getting infected in those scenarios.
Yeah. So do you think now that filtration and ventilation are the new masks?
Yes, I think that's the next. We're already seeing it. Germany is looking at all of its places for this. So I think this is going to be the newest kind of frontier. And also, as I said, getting people outside more and saying so in Scotland right now, you cannot visit other people inside their homes, only outside. And I think actually that's quite good because people are seeing each other, but they have to go outside to do it.
Let me bring you back to what is closest to your heart. Has this pandemic reminded the rest of us that besides your cardiologists and your oncologists and internists, public health doctors also matter?
Well, I hope so. If this hasn't taught people, then I don't think anything will. Medicine traditionally is about treating. It's about treatment. So when someone is ill, you treat them. Public health is preventing someone getting ill in the first place. And so I think that's what this shows, that actually you much would rather keep your numbers low and have nobody ill with this, or very few people, than to try to treat your way through it. And I think if we can keep that approach going into the future, that will be fantastic. And it's a very holistic way. I mean, prevention can be clean water, good food, sanitation, making sure there's parks, green spaces, mental health. It's about how do we make sure people can live healthy and fulfilling lives and prevent them getting ill, prevent them having to go to a doctor or to a hospital.
So public health is not some esoteric pursuit, esoteric, not very empirical, not very evidence-based pursuit, as a lot of people seem to see it.
Not at all. Quite the opposite. I mean, actually, if you look, there are studies done where we try to compare, all kinds of going outside of COVID. But for example, studies on green space. Does out of green area around your home affect your health? Air quality. How does that affect your health? Public health is about all the environmental factors, the societal factors that determine our health. They're often more important than, when someone gets ill. So how do we prevent people from getting diabetes rather than, it's also important to treat people who have it, but how do we prevent them developing it in the first place? So I think hopefully people will see it as an important area and one to invest in going into the future, because it's much more costly to try to treat people once they're ill than to actually prevent them getting ill, coming back to the economic arguments as well.